My name is Randi Kerr, and I'm a third-year medical student at OSU's Cherokee Nation campus. My team's project is called Anxiety in Elementary Age Children in the U.S. from 2016 to 2022, an analysis of the National Survey of Children's Health. During the COVID-19 pandemic, more than 200,000 children in the United States lost their primary caregiver. Disruption to the supply chain because of COVID-19 also drove up the prices of food and housing. Additionally, parental unemployment peaked at 21%. With all of these stressors, we wanted to investigate anxiety in elementary age children. We extrapolated data from the National Survey of Children's Health, which is an annual survey sent to households throughout the United States with children ages 0 to 17. We looked at year-by-year data for the prevalence of anxiety and the severity of diagnosed anxiety using linear regression with 2016 as the reference year. The first question that parents answered was whether a doctor or other healthcare provider ever told them that their child had anxiety problems. So again, using 2016 as our reference year, we can see that children had a prevalence of anxiety of 4.86% in ages 5 to 9. In 2022, we can see that it peaked at 6.36%. So looking at this data on a graph, we can see that there was a prevalence of roughly 4.5% in 2016, with the peak at almost 6.5% in 2022. After we determined the prevalence of anxiety in 5 to 9-year-old children, we then took that data and used the parents' responses of whether the children had mild to moderate anxiety symptoms or severe anxiety symptoms. So looking at the severe anxiety symptoms, we can again look at the reference year of 2016, which was 4.10%. In 2021 and 2022, the data was statistically significant. And you can see that compared to 2016, 2021 data had doubled for children with severe anxiety symptoms. And it was nearly double in 2022 as well. And again, this is a graph that shows that in 2016, the data was about 4.5% for severe anxiety, and it was about double in 2021 and 2022, which again were statistically significant years. So putting this into a broader framework, we can see that children are developing crucial social skills at the age bracket that we're looking at. So before ages 5 to 9, at 2 years old, children engage in parallel play where they're playing alongside each other. At 3 years old, children begin playing together. At 4 years old, they begin asking to go play with others, even when their friends are not around. So if children are alone, they might ask, can I go play with Alex, or can I go to Emily's house? And at age 5, children understand friendship and may have another child whom they call their best friend. So these children in the study that we looked at, ages 5 to 9, could have been at these crucial points in their social development during the COVID-19 pandemic and may not have been able to develop these social skills. And we know that general anxiety is multifactorial. So while this study did not specifically examine social anxiety, this could be one factor for the overall increased anxiety that we are seeing in children due to the COVID-19 pandemic. So overall, we know that childhood anxiety has increased over time. That's what our data shows. The American Psychologist Academy states that there's been a decade-long mental health crisis among children. And while we know that adolescent anxiety is a predictor of anxiety as an adult, maybe we should be looking at anxiety before the child reaches adolescence to allow for early intervention with cognitive behavioral therapy or even pharmacotherapy if necessary. Because we know that early identification can allow for early intervention. Thank you for listening.